Hello and welcome to this Royal Society event where we are discussing long COVID. I know that's a subject that many of you are interested in and many of you have perhaps suffered from. So there's going to be an opportunity throughout this event to speak to the panel, the expert panel, and ask them questions. The way to do that is to go to slido.com. And when you get there, you'll be asked for a login and you type C804. There are two sections to that. One is a Q&A section, so you can type in answers or you can vote up questions that have been answered or asked. And I will look at those and I will ask as many as I can to the panel. And there's also a polls section. And so we're going to conduct really 4 polls throughout the night to get a sense of what you feel about long COVID and how it's affected you. You can also tweet, actually, as a hashtag COVID science, if you'd like to tweet. So because I know this is particularly interesting to many of you, I want to get straight to it. So I'm going to ask the expert panel to introduce themselves.
Shall I start, Brian?
Yes, please, Paul.
So my name is Paul Elliott. I'm Professor of Epidemiology and Public Health Medicine at Imperial College London. And I'm director of what's called the REACT study, which has been monitoring the spread of the virus, both through testing for the virus directly itself and also looking at antibodies since May of last year across England.
I go next, Brian?
Yes, please.
Yeah, so I'm Dr. Nisreen Alwan. I'm an Associate Professor in Public Health at the University of Southampton and Honorary Consultant in Public Health at University Hospital Southampton. And I'm here because I've got lived experience of long COVID, but also been doing lots of advocacy and some research on long COVID over the past few months.
Me next, I'm Adam Rutherford, and I'm a geneticist at UCL, but you'll probably know me better as the presenter of Inside Science and the Curious Cases on Radio 4, alongside Brian. And I guess I'm here because I also have lived experience of long COVID. I got COVID March 16th last year, and I still have symptoms to this day. So I'm still trying to work out how to manage that.
Hi, so I'm Nish Chaturvedi. I'm a clinical epidemiologist and have recently been funded to study long COVID using population longitudinal studies and anonymized electronic health records to understand the definition of long COVID, its risk factors and its outcomes.
Well, thank you all. And I should have said, actually, there's a live captioning available this evening. You'll see a link at the bottom of the window. It's titled Subtitles Closed Captions. And so you can click on that and get captions. To start, to get our polls moving, we've got one question for you. So if you look on Slido now, you should see the question, which is, what do you understand by the term long COVID? And you can type a word in there, and we're going to make a word cloud of that to get a sense of what you understand about that condition. And that's really where I want to start with the panel by asking what exactly is long COVID? And I thought I'd go to Nisreen to ask that question, particularly if there is an accepted medical definition of long COVID.
Thanks, Brian. So yes, the problem is with your word exactly, that's a problem. We don't have a universal specific definition of long COVID yet, but I would still define it as not recovering, so not going back to baseline health, so the health that you were at before COVID-19 infection, and the time for that really depends, and people define it differently. But usually, I would say for more than 4 weeks. So if you don't go back for more than 4 weeks. However, it's important, just to mention quickly that NICE. So we've got some clinical guidelines, and they recently, and they say that they break it down. So they say you've got ongoing symptomatic COVID-19 if you have symptoms between 4 to 12 weeks. And then you could have what's been called in the guideline post-COVID-19 syndrome, which is sign and symptoms consistent with an infection for more 12 weeks after the infection, if there's no alternative diagnosis.
So it's, roughly speaking, you should have expected to recover to a large extent within about 12 weeks if you haven't, then that could be defined as long COVID.
That's right, although it could be sooner than 12 weeks, depending on what you call it as well. For example, the recent statistics by the Office of National Statistics use a cutoff of four weeks for their question about whether people have long COVID or not. So it depends.
And I think I should just ask you and then Adam, because you've had personal experience of it, to very briefly describe what that experience has been.
Adam, do you want to go first?
Yeah, sure. I mean, so as I mentioned, I got COVID mid-March 2020. Last year, I was a COVID hipster, before it became fashionable, and I got it pretty severe. So this was at a point where people were talking, and indeed I was on the radio saying it feels like a mild flu, and then about a few days later, I was very close to being hospitalized and should have been hospitalized. I had a secondary infection on top of that. I don't need to go into too much detail about it, but was treated successfully, and in the sense that my COVID symptoms were alleviated. But it's now more than a year since then, and I still have lung difficulties. Now I'm 46. I was pretty healthy for a 45-year-old this time last year, and of the symptoms that people with COVID and with long COVID have, of which there are many, really now I only have tightness in my lungs. So my upper respiratory tract. I'm talking to you from my bedroom, in fact, which is on the 3rd floor of our house, and I can't get to the top of the house without having to sit down and being short of breath. Now that's not right? That is not a return to how I was before. I've been doing plenty of exercise and doing as many things as I can to recover properly, but there's something in my lungs which isn't shifting. So that is common with lung infections. There are other lung infections which take a long time to recover from, and because we're only a year into this and a year into my personal symptoms, it's just difficult to know what is actually going on.
Nish, could I bring you in? Because there's several questions on this. Of course, the obvious question is why? What do we know? I mean, Vivian Mosel, for example, has asked a question asking, well, is it somehow related to the immune system? So what do we know about long COVID?
So as Nisreen and Adam have said, it's fairly confusing because we can't define it properly. People complain of around 50 symptoms. Some have just one or two, some have many symptoms. So making a definition is quite hard. And there's some sense that it may be a cluster of several different syndromes, perhaps one clustered around fatigue and muscle weakness, perhaps another around the brain fog that people complain of. What's striking is that the people affected with long COVID are not the people necessarily who are more at risk of COVID. So unlike COVID, people with long COVID are more likely to be women than men, more likely to be middle-aged rather than older folk. And there doesn't seem to be the ethnic disparity that we see in COVID infections. So it's all really quite puzzling. In terms of mechanisms, the immune system is one. It could be that people are not clearing the virus as effectively as they should. Another hypothesis is around the microcirculation, that it's long-term microcirculatory damage. But the reality is we don't know, and the research that I'm doing and that Paul is doing is aimed at trying to find out exactly what it's due to.
Yes, Paul, could I bring you in? I mean, again, a lot of questions here. Bethan has asked, is there a link between long COVID and lack of rest during the initial infection? So I suppose there's a lot of speculation here that I'm seeing about people just asking questions. What was it? So could you elaborate on what we do know?
Yeah, so sort of building on what Nish and the others have said. So first of all, within our database, we've actually been to more than 1.5 million people over the course of our study. And we have around 30,000 people that we know did have virus that was tested either with a PCR test looking at the virus itself or with an antibody test. And when we look at the symptoms that people have, it is a constellation of many symptoms, as Nish says. And we certainly see this, what happens in the first 4 weeks, then between 4 and 12 weeks, and then beyond 12 weeks. So we really have to understand what these different constellation of symptoms mean. And we also need to very much listen to people like Nisreen and Adam who are suffering from long COVID, because this is very much, as Nisreen said, a lived experience disease, because it's completely new. So COVID-19 is new, long COVID is new. Like Nish, we're doing a study of long COVID embedded within our REACT program. And we're really trying to understand the mechanistic underpinnings of this disorder by looking for things such as long-term inflammatory response, looking also at the genetics, because we know that the people who are very severely affected, there are some genetic susceptibility, and we're going to be looking at that. We'll be doing whole genome sequencing on people who have had COVID and some of those who have had long COVID. And we're also going to look over the long term at what happens to people who had symptoms just for that first 4 weeks, or for 8 weeks, or 12 weeks or longer. What happens to them over the long term? And how does that compare with people who tested negative in our study? In very large numbers, we'll be talking about over 100,000 people that we'll be following up. So I think it's a new, the thing is, Brian, it's a new condition. We've really got a lot to learn. And we're just beginning now to start to just put together, and as all the others have said, we haven't got a good definition. We need to listen to the patients themselves to try and understand what that condition cluster is, and then to follow those people up to see what happens over the medium to long term.
Yeah, and as you said there, quite a lot of people clearly are suffering from long COVID, are asking questions. I know, Adam, just before we went on air, you'd said that you are now about to be scanned as part of this research. So can people expect, who are suffering from long COVID, expect to follow up at some point, not only in clinical terms, trying to help, but actually in terms of the research into what this condition is?
Yeah, and this is why events like this are so important, because the sort of foundation of understanding the etiology of any disease is actually just harvesting data, right? And the fact that we're only a year into this, and that there are people like Paul and like Nish and loads of other scientists around the country who are recognizing that this is a serious condition, and it's a chronic condition, and it is going to persist, and therefore will have long-term consequences for both the NHS and for individuals. The fact that that is all happening is absolutely wonderful. There are problems inherent to that, which are that the number of people infected with COVID over the last year or so is colossal, but the number of people who are on the books or have been entered into the system is much lower. And so we know lots about the people who are hospitalized. We know less, but some about people who did have medical consultations, but we don't know anything about, or Nish and Paul should, and Nisreen should correct me on this, but we don't really know anything about the majority of people who we presume either had COVID mildly, which is most people who had it, or didn't have any symptoms at all, who may yet develop symptoms as a result of long COVID.
I think Paul wanted to comment there.
Yes, I think this is a really important point, Adam. And just to say that the study that I'm involved with, the REACT study, is precisely looking at people in the community. So we recruit people regardless of symptoms, and we test them for the virus or for antibody. So we have in our study people who were non-symptomatic but had COVID, who were symptomatic, had mild symptoms. Clearly, some of our people did go into hospital, but the vast majority didn't. So we are actually tapping into that group of people that you're talking about, and you're right. That's the bulk of the people who've been infected with this virus. And we also know that long COVID can affect people who are in hospital, but also people who weren't in hospital. And people who had very severe symptoms, but people who had more mild symptoms. And so we've really got to look at that total picture.
Can I comment?
Yes.
Brian? Thank you. I just want to reinforce how important it is, because it's such a new condition, that we really need to take different research methods. So exactly what Paul was saying, surveys are really important to capture the people who are not being labeled or accessing the health service and being, diagnosed with long COVID. Because that could be quite biased in terms of who actually gets there. But also it's important to, to study the people who are accessing the health service or who are going to their GP and being diagnosed with long COVID, but being wary really that a lot of people, particularly those who hadn't been tested in the first wave, may be labeled with other diagnoses, and that's something that comes across again and again from people with long COVID, is particularly in the first few months where nobody knew anything about it. A lot of people were being labeled as, having stress or anxiety because it was just, very unknown. And the third type of research that is really important is to talk to people. So what we call qualitative research, to really understand what's going on and the experience of people. So if we bring all of these together, we hopefully can understand more about it.
Well, it's interesting that you say that. I'm just looking at the word cloud, actually, where we've almost 600 responses. The biggest word is fatigue. And there's some fairly common ones: chronic fatigue, debilitating long-term symptoms, brain fog, and then breathlessness. So, but quite a few, it's frustrating is one of them, post-viral syndrome, chest pain. So given that I think fatigue seems to be the number one, which I think, as you said, Adam, seems to be and shortness of breath. But is it a problem diagnosing? Because just looking at that word cloud, there's a lot there, a lot of very diverse symptoms.
There are a lot of symptoms, but actually with some of the research that we've done and others have done, there are patterns emerging of how these symptoms cluster. And so there is a way of trying to characterize this illness, because they, do cluster in certain ways, and we'll know more from the other studies, Paul's and Nish studies as well. And there are symptoms that tend to appear a bit later. So the cognitive dysfunction symptoms, which is the brain fog and the poor concentration memory, it's concerning that for some people they appear not at the start of the illness, they appear a bit later, weeks in or months in. And palpitations, for example, they tend to become more common later. And there are symptoms which disappear, and they change. But there is a common thread as well, is that for most people with long COVID, the symptoms tend to be fluctuating, or they come and go. And that's certainly my experience, where there are periods where you think you almost recovered, or you almost, for me, there were a couple of times I thought, that's it, it's gone. And then there you go. And actually this really brings you down a lot, because and this seems to be a common experience. I don't know if Adam, you have the same.
No, it is exactly the same. And I think there's a couple of things to say about this. That what I've noticed is, the kids went back to school, what was it, 2 weeks ago or 3 weeks ago. And of course, even outside of lockdown and the era of COVID, schools and children are like plague ships anyway. And so at the beginning of term, you always come back and they've got some cold or some sniffle. And what I've noticed is that if I get a cold, just a minor sniffle, it just goes straight to my lungs and hits me like a freight train. And I'm in that at the moment. I don't want to make this all about eliciting sympathy from this esteemed panel, but that is the experience that I'm going through. And the other thing worth noting as well is that fatigue, that word that was right in the center of the word cloud there, isn't necessarily what I think a lot of people think it means. It's not just tiredness, right? Tiredness is part of fatigue, but fatigue covers a whole range of both physical and psychological behaviors and complaints, which are sort of all pulled together into this one term that we use quite casually. I'm pretty tired, therefore I'm fatigued. They're not quite the same. And I think we can almost do with a sort of a breakdown of what fatigue really is, because it might be that you have some symptoms of fatigue and not others. And it's not just the same as being perpetually tired, which I just think comes with middle-aged.
Nish, I just wanted to ask before we move on from this introduction, which is, gone on for 20 minutes. Is there any parallel with this in any other illness? Because we hear about post-viral syndrome, and is it really unique, this set of symptoms that, as you said, it's very strange, it comes and goes, we don't really understand why? Are there any similarities with other viral infections?
Yes, there are other viral infections which you do see similar patterns, perhaps not the multitude of symptoms that we're seeing with COVID, and that remitting, relapsing course that Nisreen and Adam describe, and other folks who are suffering with long COVID describe, is not so apparent in these other syndromes, but you do see that. And it's not surprising that it is a multi-system disorder. So initially, clinicians were a bit bemused by the fact people were coming forward with a multitude of symptoms, and that almost contributed to some dismissal of folk, coming forward with so many symptoms. But it's absolutely real, and it's something you would anticipate, given the nature of the infection, given the multi-system nature of the infection, that you would expect to see a multitude of symptoms. I'd also say we talked about fatigue, which was in the middle of your word cloud, and that makes it really hard for individuals with long COVID to get a diagnosis, to get recognized by the GP. Because as Adam says, you come along to the GP with a different expression each time of tiredness, fatigue, not being able to do things, not being able to think things through. That actually getting a diagnosis is hard, and then getting a referral on for further investigation is harder still.
Well, we're going to come on to what can be done and what is being done about long COVID, treating it and recognizing it and so on. I wanted to introduce the first poll. So we've had the word cloud, which is tremendously useful, stimulated a lot of discussion. We felt it'd be useful to know how many of you that are watching now or listening now have had long COVID or are suffering now from long COVID, or how many of you know someone who's suffering from long COVID. So if you could go to the poll and just vote, it's just a simple yes or no vote. The question is, have you or anyone you know suffered from long COVID or experienced long COVID symptoms? So that will be a useful snapshot for us. I wanted to ask, and anybody on the panel can take this initially, whether we should consider COVID, long COVID, to be the next stage of the COVID crisis. Because we hear, things are in this country at least are going in the right direction. The vaccination program is going magnificently. But is the next stage dealing with many, perhaps millions of people who are suffering from long COVID? Maybe Paul.
Yeah, maybe I could start. Absolutely, this is going to be a major, major issue. If you think of the number of people who've been infected in the country, and then the proportion of those, and it could be a big proportion, and we were talking about symptoms that last more than 12 weeks. The estimate, certainly from our data, maybe even a bit higher, but from the Office for National Statistics, well over 10%. They were talking about in their recent survey that over 1 million people have long COVID. I mean, this is a huge problem, and we've really got to get to grips with it, both from the research side to understand what is the cause and the mechanism, because if we can understand the mechanisms, we can potentially find treatments to deal with those particular mechanisms. And then also we need to find ways of managing the symptoms and the best way of managing the symptoms, and that is also an active research program. So this is going to be this is huge, and we're just beginning to start now to understand what we need to be doing, because there's very large numbers of people who are suffering right now.
Well, just to underline what you said, we've had over 1,000 votes already on that poll, and 83% of people say they know someone or have suffered themselves from long COVID. So that's a fair fraction of people, up to pushing up towards 1,100 votes now. What then is are we going to do? Maybe I could ask Nisreen, what are the resources that are available now, and what are the resources that we hope will become available as we go through into the future?
Yeah, so I think I have to first mention that long COVID is a completely patient-driven thing, so the patient came up with the name long COVID and really are the experts, and the first resource that everybody had was the patients themselves, so the support groups, people supporting each other mainly on social media, and kind of reassuring each other, going through the symptoms. So this is not an official resource, but I think it has to be mentioned that it's probably the most important resource for people to have that support among them. And then obviously the other support is if people are struggling, they need to go and see their doctor about it. And I think that's now I hope it's easier, because in the first few months it wasn't easy, and people were dismissed a lot because we just wasn't known. So it was just, a lot of it was attributed to anxiety, and that created more anxiety. If you've got the symptoms and the doctor have no idea what it is, and you don't know how it'll all end. So that was a vicious cycle. But I think it's important for people, anybody who's listening who think that they've got long COVID and haven't been in touch with health service at all, they should now. Doctors know more about it. There are the long COVID clinics to be referred to. And I think it's really important to say that even though we don't know how to treat it now, because we need the research, there are conditions that could be underlying the symptoms that with tests and scans and things could be picked up on and could be treated, and that could be life-saving, things like blood clots or heart conditions. So I think it's very important for people to access the investigations that they need from their doctors.
To go to their GP. I just want to ask, there's a question that a lot of people have voted up, which is there any evidence at all that suggests that, well, having the vaccine, because people now who have long COVID, as you said, 1 million people or more will be being offered the vaccine. So do we know anything about whether that's perhaps helpful to the condition, or how should people feel about being vaccinated during that time that they have long COVID?
So, oh, sorry, Nish, do you want to?
I can make a quick start and then maybe others can chip in. There's anecdotal evidence that people getting the vaccine actually get better. And the sense is that it actually helps you clear residual viral load, and certainly doesn't do any harm to your long COVID symptoms. So we would encourage folk to come forward for their vaccination if they should have long COVID. Welcome comments from the others.
Yeah, I mean, I completely agree. There was a very smallish study recently published as a preprint that suggested that some people improve. Most people definitely don't get worse. So there's no reason at all to think vaccine is not recommended for long COVID, and there might be a good sign that it is. And I think the hypothesis around how vaccines could improve long COVID is maybe around two things. One is because the underlying hypothesis of long COVID, we still don't know, but one of the underlying hypotheses might be there might be some persistent virus at kind of low levels causing these symptoms, and then you would then hypothesize that the vaccine could help with that. But the other, maybe more common hypothesis is some dysregulation of the immune system in people with long COVID. And even for that, I think there is a hypothesis that if you take the vaccine, it's almost like a reset button for your immune system, and that could then help your long COVID. Whether that's long term or not, we don't know.
Can I ask if either of you or Adam, have you been vaccinated yet? Are you still too young?
Yeah. Wow, that phrase doesn't happen very much these days. Yeah, I haven't. I'm in the low risk demographic group. But an interesting thing in terms of just being, going to the GP, and this is no way a criticism of the NHS or my particular practice, who are excellent, but it's taken a long time to get to the point where my personal symptoms and just the principle that long COVID is a real thing is being treated with a sort of clinical way, partly because it's difficult to know what it is. We don't have definitions. We don't know how to treat it. There's the constellation of symptoms that all you guys have been talking about. But weirdly, in between, I got an online consultation with my GP like 2 or 3 weeks ago, and their initial response was try this inhaler, which I thought, I don't think this is going to be quite right. But about a week later, they got back to me and said, I've just come back from a long COVID training session, and we think you need an X-ray, a CT scan, and a blood test at the hospital, which I'm doing next Thursday. So, this is a moving target. We are gaining both scientific and clinical knowledge and clinical application of that knowledge. It is happening now, but we also know that there's a sort of element of postcode lottery to being treated clinically for these symptoms.
Paul, a lot of people asking, because a lot of people in the audience are suffering from long COVID, how they can help in terms of the research. So is it the case that you can volunteer to be part of a study, or is it that you will be contacted at some point, hopefully?
So our study is, as I say, based on the fantastic participation that we've had in our big program. But it's fair to say that we are definitely talking to, wanting to understand the patient experience. Nisreen is actually advising us, and we have a group of people advising us, including people who have long COVID. So I think for our own study, we may want to involve some people from the community beyond those that are actually in our study already, who already have long COVID, because we've measured it. And I think generally, I think there is a desire very much to involve the community.
And how would people find out? Would it be through their GP, or will it be well publicised if that opportunity arises?
I think for research programs, I'm sure that people would be asking people to take part. But I think that Nisreen might want to comment on this, because she's actually on our patient advisory panel and helping us with this.
So I think people would know about research. You know, if there is recruitment, there will be research, and I think all of the studies that have been funded, and maybe Nish would want to come in, are in the kind of forming stage now in terms of recruitment. So I think you'll know, for me at least, I mean, I'm active on Twitter with long COVID, so if there are opportunities, I'll definitely post them there and on other platforms. I think it's also important that to say that people who had long COVID the longest, which are people in the first wave, really need to be part of the research, and that's crucial, bearing in mind that many of them didn't have any access to testing. So that's one barrier, but then the research need to find a way around this, because they can offer the most information because they've had it for a long time. But I suppose that doesn't apply to REACT, because REACT have tested people from the start. I don't know, Nish, if you have anything to say about that for your study.
Well, I'd echo what you've both said, that if you were invited by any of us to take part, please do so. And also that we need people without long COVID, or people who've not had COVID, also to take part in our research. And we'll be contacting those folks as well, because we need to be able to compare the folks who've had long COVID with people without. So just because you haven't had any association with COVID doesn't mean to say the research is unimportant. You'll really make a strong contribution to our understanding of this condition. If you're invited to take part, please come forward, and we'd be delighted to see you. And
I'd like to add, just to add on that point, because we did a survey for long COVID through social media, which was absolutely great. But what's really valuable is to compare not only to people who've not had long COVID, who might have less incentive to take part in research because they're fine, but also people who've recovered from long COVID. We really need to know about these people. So that's really important.
If I may say, that's exactly what Nish says and what Nisreen says is really, really important. So we're going to be looking at people who've got long COVID, people who we know tested positive but then recovered within the 4 weeks, people who recovered between 4 and 12 weeks, but also a large number of people from our survey who we tested who tested negative. And Nish is absolutely right. We really want those people to take part, because it's understanding the natural history of this new disease in comparison with what you'd expect from similar people who didn't test positive, who didn't get COVID. Because that's how you're going to understand what are the specific features and what are the risk factors and what are the outcomes. So it's really important.
Thanks. I wanted to ask the next poll question, because I think it will stimulate some discussion, which is a question to you watching, which is, what should be done, in your opinion, to support those living with the impact of long COVID? And we've given you 5 options for the poll. One is more long COVID clinics. And I know we've had several questions on that issue about the long COVID clinics. I'll ask that question in a moment, actually. Where are they? How many are they? Will there be more? So more long COVID clinics, long COVID training to doctors and to your GPs. That's one of the options. More research, which is what we've talked about. National support groups, or then there's an option for something else, another. So I think it would be really useful, actually, in about 10 minutes or so towards the end, I'll come back and look at that, because it'll be interesting to see what you think, as many of you as sufferers, would be the most useful thing to you. There's a question, a lot of questions. The most voted question, actually, which I'll ask to the panel, is what recommendations you'd give to working people, and by extension, it might mean quite specifically, actually, their employers, who are finding it difficult to get back to work, and in particular work in the same capacity that they were working in prior to catching COVID, now that they're living with long COVID. So what recommendations could you give, and what should people in that position say to their employers?
I think it needs that the employers need information. They need guidance and information to tell them that this is happening, and it's happening on a vast scale. And it's great that we have the ONS figures now to tell us, you know, how big a scale it is in people experiencing long COVID. I think it's not just on the onus is not just on people. I think the onus on I suppose the government to kind of really, you know, communicate to the public and to employers that this is a problem, and people will need time to recover. People will need, you know, sick pay, you know, employment rights, and obviously one of the things that was demanded by the All Parliamentary Group in the first parliamentary debate on long COVID in January was to consider long COVID as an occupational disease, because we know that people in certain occupations are more likely to get COVID and therefore get long COVID. And the ONS figures actually confirm that, because the highest number occupation with the estimated long COVID with healthcare professionals, and then teachers after that, or people in teaching and educational professions. So I think there needs to be more awareness, because, and that's where the inequality society come, because if you can afford to rest, and if you can afford to take time off sick, and you don't lose your earnings, then you probably got a better chance of recovering, and people who don't have that need support.
I think that's interesting, actually. There's a related question, actually, which has been the top voted question now, which is, did the panel think long COVID will be classed as a disability? And I suppose it's what we're asking here, I suppose, is whether, you said it may be classified as an occupational disease, whether it needs classifying in order to provide protection for people who are suffering from it.
Well, it's not just an occupational disease. It certainly, as Nisreen said, I mean, there were particular groups, and healthcare workers is an obvious one, and education, where people were more exposed. And certainly early on in the first wave, that was very much the case. But it's also very much true that this is being transmitted through community infection, community-wide infection. That's what we've been measuring in the REACT study. So I think I completely agree with Nisreen. You know, this has got to be looked at very, very seriously, because there are going to be people, and you've got examples on this panel, who, I mean, as Adam said, you know, he has fatigue going up the stairs, and people are going to really struggle to get into work, and there's got to be some recognition that this is a disability. I mean, the issue is still, we really got to, you know, we as researchers have really got to work out, you know, what is the context of the disease, what are the mechanisms, so that we can really understand what it is people are suffering from. But I think it's got to be taken seriously, because people cannot go to work if they're, you know, really suffering from this condition.
I think there's a really, really important point embedded in that, which also relates to some of the things we were talking about earlier, which is that the fact that lots of people have had COVID, and haven't had symptoms, and now, you know, whatever the numbers are, maybe up to 1 million people have got some persistent symptoms that we're calling long COVID, which is that, you know, something that Nisreen has been saying for months now, which is you shouldn't suffer in silence, right? The reason we have to get these messages out there is that this is a real thing. It's a real disease, a chronic disease, which has long-term personal health impacts, which will have long-term economic impacts for work and for the NHS and so on. And there's a bunch of people out there, we presume, who may have these symptoms and just are thinking, you know, I'm just a bit tired. This is a stressful time for everyone on earth. and there's going to be a lot of people out there who are coping very well with the fact that they feel fatigue or some of those symptoms, but actually might have a clinical diagnosis which is going to be both informative for the research and informative for their own health and how they should be treated. So it's important, really important, that we recognize the seriousness of it as a disease modality and in terms of personal health impact.
What's interesting, actually, I'm just looking at the poll, is that it's quite striking to me that almost 1,500 people have responded, and about half of them have said the most important thing is research into understanding the illness. And that's with 5 options. So that seems to be the overwhelming preference. That the sense I get is people want to know what they're suffering from. And I suppose that the sense that as I've been looking through the questions, there's a sense, I think people would like to know how long this is going to go on for. Do we have any insight? Perhaps, Nish, I can start with you. Do we have any insight into how long COVID persists?
So I guess a bit of good news is that people do recover, and there's information from people who've been hospitalized, so not from the general population, but people who've been hospitalized, that a variable proportion of them have recovered by about 5 months. So those with relatively mild symptoms, around 40% have recovered. Those with more severe symptoms, a much smaller percentage, around 10%. So people do recover. And we've talked about this earlier in this discussion, that studying people who've recovered and understanding their pathways to recovery is a really great way of firstly understanding the mechanism so that we can help other folk, but also just understanding the disease so that GPs and individuals can help themselves to recover.
There's a question actually that's coming up a lot, probably unsurprisingly, particularly from parents, is what we know about long COVID in children. Because of course we hear that we know that children don't suffer as much from the disease initially. But what about long COVID in children?
So the link between the severity of infection and long COVID isn't strong. So you can get long COVID even if you've had very mild disease. And there is research that's been funded at the same time that Paul's study and my study was funded, a study specifically about long COVID in children. And again, like us, recruiting children from across the country, asking them about their experience of the disease, which may be quite different to adults, and asking them about their recovery and about pathways to recovery and understanding the mechanisms. So research is going on in children, but it certainly does occur in children. It's not a group that we should overlook.
And if I may add, again, referring to the recent ONS statistics, it's much less common in children, but it's still, the percentage is 7% in those aged 2 to 11 and 8% in those aged 12 to 16 who would still have at least one symptoms 12 weeks after testing positive, and these in the children. So they are lower than the adults, but that's still a concerning percentage because, you know, if you have symptoms for that long, then infection should be regarded as bad news, really, for any age group. And we, you know, children need to be protected against infection, particularly that we really don't know what's going to go, you know, happen, the long-term consequences. We need the research, we said. So I think it's not, it's important to have that balance, you know, that children are less affected, which is a great, you know, good news really about this pandemic, maybe the only good news, but also not to dismiss it in children because it is happening in children as well.
I think just to ask, there's an interesting comment here, which is which many people have voted for. 80 people have voted for this comment, which is that there's a stigma attached to long COVID. There's a lot of people who say you know, I suppose it's online and other places that say it's fake, it's nonsense, it's all in the mind. I think we've sort of answered that, but it might be worth commenting on because so many people have voted for that statement. It was by Andy who said that he's finding it personally difficult because of the stigma attached to it.
If I may say, this is absolutely a crucial point because it's so if you if people start saying, well, you're imagining these symptoms. I mean, some of the comments around long COVID say, well, these are self-reported symptoms. Well, fatigue is self-reported. There is no other way to assess it. So most symptoms, there is no other way to assess them. And what happens is, if people have that a lot, whether that's from their healthcare provider or whether it's from their friends or family, then what they do is what we call internalize the stigma. They then start not, doubting themselves and start not actually seeking help or support for their symptoms. And that's even worse. And that happens in other, illnesses as well, like, for example, HIV. So we've got a lot of examples of that happening. And we really need to acknowledge that and remove it. And there are certain groups in society who would suffer more from this stigma because they are less believed. So, classically, more women and ethnic minorities are less believed about their symptoms. And then it just becomes that vicious cycle of then not seeking help. And there might be something that healthcare could offer, particularly around if there's a treatable condition, as I said, at the start, or just support from others and rehab. So yeah, big problem. Stigma is a big problem, and we need to talk about it and try and avoid falling in the trap that other illnesses, chronic illnesses or other infection have fell in terms of that.
Yeah, I'll just show it very briefly, Adam, because you're quite high profile and you've made it known that you're suffering from long COVID. Have you experienced that? Have you felt that there's a stigma attached to it in your interactions?
No, not really. But I guess that's probably because I am, in a privileged bracket in society. And what we know very clearly is that medicine is heavily stratified by various social demographics. We know that very well with regards to race in Britain and in the rest of the world, that people of racialized categories are far more likely to be infected and indeed to die from COVID. There's been attempts to sort of geneticize that is a new word which I'm now coining, which I think is not particularly useful, because these sorts of social disparities in medicine are far more easily explained by these disparities are far more easily explained by social characteristics, social phenomena than genetic. I think it's very interesting that Nish or Paul, I can't remember who said it, indicated that those racialized disparities, and we're not seeing them as strongly in long COVID as compared to COVID, the initial COVID infection. And I would love to know why, if we have any. I mean, Nish, do you have any ideas as to why that would be?
No, I'd love to know why too, Adam. This is just, we're all saying this is really a very new condition. This information is just emerging. Oftentimes, many of the research projects that people have, there are very few people from ethnic minorities within those. So again, reiterating what Paul and I have said before, if you're invited to take part in research, please come forward to do so, because that's the only way we're going to understand why it is that ethnic minorities are not overrepresented in the long COVID. Could it be, sadly, that perhaps the ones who are most vulnerable succumbed to the infection itself, so didn't survive long enough to get long COVID? Well, at the moment, we don't know.
And I'd like to perhaps ask Paul, there's a question here from Steph Hancock. A lot of people have voted for it, which is related. We're talking about different groups in society and whether it's more likely they'll suffer from long COVID or not. But Steph asked specifically if there's any evidence that it's more prevalent amongst young, healthy, fit females. So perhaps I could ask Paul, but more broadly, is there any evidence that particular groups are more likely to suffer?
So we know it happens at all ages, and we already discussed it happens in children as well as in adults. It does appear that women are more susceptible to long COVID, and particularly maybe in more middle-aged women, possibly related to other autoimmune type conditions where we know that women are more susceptible. But yes, young people can get it, older people can get it, and I think it's really a problem that goes right across ages, both sexes, different ethnic groups, but maybe not overrepresented in ethnic groups. So yeah.
So I'd like to. We're down to the last 10 minutes, sadly, but we've got a last part of the discussion that we'd planned, which is the impact of long COVID on society. And so our last poll is that? It's a question, what do you think will be the biggest impact of long COVID on society? So if you could answer that in the last poll. Whilst you're answering it, and I'll look at that in a moment, I'll ask the panel. So maybe I'll start with, well, who'd like to take it? Shall I start with Nisreen? I'd like to get all your answers in. We've only got 10 minutes, so brief if possible. But what do you think the biggest impact is going to be?
I mean, that's what we were discussing, really. You've got these younger age group, suffering with this huge numbers. We don't know how long it'll last, and we just don't know how this will affect productivity. I mean, it's really painful every time you see the headlines about public health or the economy and we need to balance things, and you're shouting, well, I'm shouting at everything, saying, but all of this long COVID, how will this impact the economy? Nobody's quantifying that. And it's because we didn't, and still really don't, quantify the morbidity from the pandemic. We focus on the acute outcomes, so deaths and hospital admissions, and we can, forget about what's happening, these kind of chronic effects. And I think we really should learn for the next pandemics. We need to prepare our systems. I mean, if we get another virus, and we could get another virus, which is largely disabling rather than, killing people, how are we going to respond to it if we don't have the systems to kind of quantify what it's doing and to respond to them? So, yeah.
Just looking at the poll, actually, a lot of people saying, unemployment, loss of jobs, damage to careers, economic impact. It's I think people are clearly worried about the impact. Perhaps, Nish, I could ask the same question for you, the impact as you see it on society.
So I agree with the economic impact. There's information from the hospital surveys suggesting that 1 in 5 people have had to change their jobs or stop working. This is an economically productive part of the population. It also impacts on families, that those people will not be able to participate in family life, will not be able to help bring up the children. So it's a huge economic effect that we will be seeing as a consequence of long COVID.
Paul?
Yeah, I mean, obviously I agree with that, but also maybe I'd just focus also on the health service. We've talked a little bit about that, but there's an awful lot that we've got to learn about how to manage this condition. And it's going to be an additional burden that the health service needs to deal with, and needs to deal with quickly. So it's, that's something that has really got to be a focus in the coming months and years, because this million people, some will get better, some will continue to have symptoms, and those will need to be managed.
Adam?
Yeah, I agree with Paul, actually. I just, obviously this is a complex interaction between a disease, between society, and between scientific research. And it's interesting that the earlier poll said that the thing that people were most, I can't remember how it's phrased, but the people were suggesting that more research is the baseline to that, which of course I absolutely agree with as a scientist. And maybe there's a skew in the fact that this is a Royal Society event and probably a very scientifically literate audience. But science has done really well in one sense out of the pandemic, in that we've really focused society's resources towards better research, towards understanding it. And of course the best outcome of this last terrible year has been the fact that we've got this vaccine after less than a year. That is a huge success for science. The fact that people like Nish and Paul and Nisreen and others have extensive or expanding research projects to try and understand this is all great. I am most concerned with the burden on the National Health Service. And there's an irony within that, because we're sitting here saying, get in the system, go to your doctors, report your symptoms, and actually in doing so are putting more burden on the NHS, because they're having to deal with not just the pandemic, but everyone else's normal health problems at a time when they're being underfunded. So that, I think, is my biggest concern, is that the long-term consequences of a new chronic disease that potentially hundreds of thousands, if not millions of people are suffering from, is going to really impact an already beleaguered NHS.
I'm trying to sort of get a sense of the questions because I've got 5 minutes left, and there is a common thread through a lot of them, which is so related to when we talked about vaccines in the previous event. There was a silver lining, which is that the research effort that's been put into developing these vaccines is going to, that knowledge is not going to go away. And I think it was said that we'd made the progress that we would have expected to make in a decade, in a year. And that was a silver lining. Is there a similar silver lining? People are talking about other autoimmune diseases, perhaps, or other chronic syndromes, ME, and so on. Will this focus research on those sorts of conditions in a way that would not have happened had it not been for COVID? Perhaps Nish.
Well, it hasn't happened in the past, and you're right to say that one of the positives that's come out of this, funding has gone into the kind of research to really understand the risk factors, the mechanisms, the outcomes of long COVID in a way that we've never done before with these other conditions. And we do hope that our research will shed light on these other conditions. So that's a positive. Paul and I have both benefited from that. And the research funders have moved very rapidly to support this kind of research. So that's a really strong positive that's come out of that.
Any other comments? Nisreen, maybe you'd like to comment?
I absolutely hope so. Really getting long COVID and then doing a lot about it opened my eyes to the suffering of people with other chronic conditions, CFS, fibromyalgia, lots of other chronic conditions their conditions have been very much under-researched, poorly understood for decades. And absolutely, we need the research. We hope the research would shed light on this as well. So yeah, but also I think the other thing we need to learn is we need to learn to pay more attention to the less acute effect of everything. I think that's a lesson we need to learn from this pandemic, because everything in policy has been determined by these by the deaths and the number of cases and the hospital admissions, and nothing around what are the long-term effect of things, and they've not been measured. So I think that's something to learn for the future. We need to have the systems in place to measure it, and that doesn't only apply to long COVID, to other chronic conditions as well. I think medicine needs to have a bit of humility in terms of we know how to deal with the acute problems much better, and we listen more carefully to the acute problems, but not so much to the chronic problems. So I hope we learn that.
If I may add, Brian, I think the focus we saw on the vaccine, which has just been a tremendous success, really accelerating everything by really years. I think we've got the same focus now on this condition. The funding's gone in. The funders are looking for real answers, quickly. Normally, something like this would be, years and years of work, and that's really being, everyone is focusing down on the problem. Both Nish and I have brought together large groups of scientists to work on different aspects to try and really understand the mechanisms. And I think I think there is a silver lining, perhaps, that we will accelerate the findings way beyond what we would normally do under a normal research grant that that we've had in our previous careers, as it were.
Yeah. So this could cross over into other chronic conditions, the knowledge that's generated by this focus. That's the sense that a lot of people are asking.
Yes, I think we definitely. Yeah.
Well, sadly, we've run out of time. It's 7 o'clock. A huge number of questions. Thank you for all the questions. I hope we've been able to shed some more light on this very serious issue. There's going to be a continuation of these events at the Royal Society throughout May, and they're all going to be streamed live here on the Royal Society's YouTube channel, and also you can watch the previous events. So please do go there. As I said, there's a conversation on Twitter, #COVIDScience. All that remains then is for me to thank everyone that's submitted questions. I hope I got through as many as I could, and to thank the panel for a fascinating discussion Thank you all, and please keep abreast of the Royal Society's channels, and we'll continue this discussion throughout May and beyond. Thank you very much.
Thank you.